So, as you heard, my name is Oliver Fein, and I am the chair of the Board of Physicians for a National Health Program, the New York Metro chapter. And I'm here today to declare our support and the support of many health workers, doctors, nurses, social workers, public health workers, and community activists for the New York Health Act. We believe in guaranteed health care for all. Young and old, Black, Latinx, Asian and white, immigrants and undocumented. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. So it is especially meaningful for me to join you here today at Lincoln Hospital. This is the hospital where I did my residency training in internal medicine in 1973 through 75, where I served as an attending physician and acting director of the emergency room in 1976 to 77, and advocated for the affiliation of Weill Cornell Medical College in 2000, which, by the way, continues until today. Wow. Lincoln is really deep in my heart, and it is one of the community hospitals that would truly benefit from the New York Health Act. Now, let me tell you a little bit more of the story. In 1969, my partner, Dr. Charlotte Phillips, came to the old Lincoln Hospital over there in the shadow of the Bruckner Boulevard. And she came as a pediatric resident. She helped start the Lincoln Pediatric Collective, which brought 32 residents to Lincoln on July 1st, 1970. 2 weeks later, on July 14th, the Young Lords Party took over the administrative control of this hospital for 12 hours, with the demand that New York City build a new Lincoln Hospital. This building here is the result of that takeover. So let me just continue for a few minutes. Let me mention that point 5 of the 10-point program of the Young Lords Party was, quote, "We want free health care for," just what we are demanding through the New York Health Act today. The Young Lords Party got a new hospital. It's up to us to pass the New York Health Act to get free health care for all. What are the principles of the New York Health Act? Number 1, guaranteed universal access to comprehensive health care for everybody. Number 2, comprehensive health care that includes hospital care, outpatient care, mental health and substance abuse care, community health centers, all medically necessary care. 3, no financial barriers to access, no co-pays, no deductibles, no premiums, no private for-profit health insurance, a single payer for all health care. 4, lower drug costs with all prescription drugs free. And 5, a publicly financed, single-payer, community-controlled health care system. Many of these principles were built into the reforms initiated by the Lincoln Collective with the assistance of community activists like the Young Lords Party. For instance, continuity of care in the clinic. Patients saw the same doctor on every clinic visit.
Turn the mic up. You can't hear.
It's as high as it goes.
Is the blow one louder or not?
I'm told it's as high as it goes. Number 2, doctor and nurse teams working cooperatively together if you were admitted to the hospital. 3, parents on the resident doctor selection committee. And 4, creation of a community mental health corps of doctors and nurses that would visit patients in their homes and preventive care and home care after patients were discharged from the hospital. Though not explicitly outlined in the New York Health Act, all of these reforms would be more possible under the New York Health Act. In summary, what do we want? Guaranteed access, comprehensive health care, no financial barriers, lower drug prices, publicly financed, single payer for all. Everybody. Nobody out. Everybody in. Nobody out. Everybody in. Nobody out. Everybody in. Nobody out.
Everybody in. Nobody out. Everybody in.
Nobody out.
Everybody in.
Thank you, Dr. Oli Fein. Before we move on to the next person,